when I work with depressed patients, many of the depressed patients that I've worked with have a core belief that they have held over their lifetime, that they are meant to be miserable, they are meant to be unhappy, that their depression is a curse from God for things that they have done wrong. They believe that nothing they do will change the way they feel about themselves, their world, or their future. They absolutely believe this. So the goal of the therapist is to do what? Induce, to create some degree of doubt in the mind of the patient, because if I can create a gap in the stream of their thought and consciousness, if I can just put a little wedge in the way that they think, that will allow them to begin to softly question what they believe. And once I have them doubting, I can then create a bigger gap in the stream of thought. And as that doubt comes into their consciousness, they begin to entertain the possibility that the way things are is not the way they always have to be. For black people, it is the same way. As it is for the individual, it is for an entire group of people. Since most black people are mentally ill, most of them suffer from racial inferiority disease, which is a form of pathology. And since all psychopathology is based on core beliefs and ways of interpreting our world, which is based on the information that we've received up to date, the first step to reclaiming the minds of our people around the world is to give them information that they have never had before, that may afford them the opportunity to look at their reality a different way and begin to interpret that reality in a radically different manner. Which means that for black people who believe that everything that white people do is right, or that homosexuality is right, or there's nothing wrong with interracial relationships, or there's nothing wrong with public school, we give them statistics. We give them white theory. We give them the hard-to-find information on the social engineering that's going on in the school system. And when they see it, it creates what we call in psychology cognitive dissonance. Cognitive dissonance takes place when what you believe and what you now know represent two different aspects of reality. When what you believe is in contradiction with what you now know to be the truth, you have to resolve that difference. And there's normally two ways of doing that. Black people will either run from the truth, as I'm sure Brother Gus has experienced when he approached African people with truth, and it is just too overwhelming for them to entertain the possibility that their worldview is wrong and that the information he's providing them is accurate. They run away from it. That's why a lot of black people run away from consciousness. They run away from revolution. They run away from study. They run away from study groups. They run away from conscious organizations. They run away from anything that is African because it is inconsistent with this set of beliefs. But then other African people will stand there and listen, and that cognitive dissonance will begin to resonate with their spirit, and they begin to do what? Search out more information. And this is how we go from being unconscious to conscious, which is why I always influence brothers and sisters when you are bringing an unconscious person to consciousness. When you are bringing an unconscious person to consciousness, you never want to shock them into reality too quickly, because sometimes when you do that, the fear will overwhelm them and they'll run away from it.